you, sir. Am I audible? Yeah. Good afternoon, all. It's a post-lunch. I have so many slides. I'll try to cut short the slides, or I'll just speak little less. And I think my talk will not make you sleep, I think. Let's see. And yeah, so today's topic, I'm going to share our experience of Motivation India, user-centric wheelchair service provision in India, a Deccanium ride of Motivation India's approach. And before going to that, I would like to introduce this gentleman. He is Mr. David Constantine, and some of you might know. And he is the founder of Motivation Charitable Trust UK. He is the person behind the various designs of motivation wheelchairs, which is available in the market for the people with disabilities across the world. And we have our operations in Southeast Asia and East Africa. And our core work is on manual wheelchairs and seating solutions. So we have reached more than 60 countries. And in India, as a Motivation India, as a charitable trust, we have our presence in 24 states in collaboration with more than 50 NGOs and government organizations. Also 350 plus professionals we have equipped, and they are available in the community to help the people with disabilities. Also directly in collaboration with the various the institutions, partner organizations, we could help 22,000 people with disabilities. It is very least when you see the big numbers of the statistics, right? And yeah, this is the scenario. Everybody know around 1 million people globally need a wheelchair. And in India, 6.1 million people. Again, it is way back in 2011. Now if you see the current scenario, it is 4 or 5 times than this, right? And still it is unmet. And it is still, there is a huge gap is there, right? And if I have a question, are the wheelchairs mass distributed in India? As a 1 decade of work, Motivation India, we say we are just presenting so many places, so many states we are saying, but still if you have a question, yes, it is. It is not changed that hugely, right? And this is what the types of need. In depth, if you go, there are some developments is happening from the way back in 2008, 10 onwards, but still the need is fulfilled or not fulfilled, we can say. Somehow it is meeting for this kind of people who can sit upright, who can be independent by themselves if you provide an appropriate equipment. Whereas what is happening with these kind of people who need little postural supports or who need extensive postural supports, there the challenge is there. There the product availability, there the service provisions are drastically missing. That's where people are getting problem, the caretakers are getting problem. And keeping all these things, way back in 2008 only, WHO developed the guidelines, and it talks about various principles of appropriate wheelchair, production and service delivery model and training and policy and planning. Way back in 2008, they spoke. Again, in collaboration with WHO, Motivation also supported to develop the various training programs as well as these guidelines. And we follow this 5P approach. Our chief guest, Mr. Chapel Kasnabis, he was mentioning about this, all the 5Ps: provision, product, personal, and partnership with the various organizations, because with a one single organization cannot do everything, right? To meet a huge need, it is very difficult. Definitely we have to join the hands together with many associations and many organizations. And keeping all this work, we could try to influence the policymakers or decision makers to have a right wheelchair in a right way, but still it is a long way for us to go. And our approach, we would like to change the paradigm shift of the donation or giveaway to the service provision. Just now, Mr. Armarali was also mentioning, many wheelchairs are just given away. In an hour, there are many people are receiving the wheelchair, but what is happening to them? What are the wheelchairs? What is the investment given to them? So it's all just in the mute. Nothing is coming in the forefront. We cannot see the people on the roads, on the malls, on the temple, nowhere, right? We can see very few people on the roads. Even morning also we can see some people are like moving on their own, and some people are pushed by somebody else. Why it is happening? Why can't they have the good hand power? They have the good abilities, but what is happening? So that's where the change comes. We need to stop, or we need to overcome this giveaway or donation to the service provision model. How we can do involved with these kind of steps? If I ask you all one question, if you get a fever, where you'll go? You'll go to hospital? Yes? If you have eye problem, where you'll go? Whom you will reach? You will go to an ophthalmologist? Yes? If you need a wheelchair for you or somebody else, where will you go? The big question is, people go to surgical shop. That's what the doctors also guiding, or many people know that. It's again, it is a marketed like a showcase piece kind of things displayed in many of the surgical shop. That's not the right way. So there should be rehabilitation institutes should take part. Our morning Nekram was nicely nailed. There are rehabilitation institutions which they have to take part in delivering these kind of devices in a structured manner. That's what the gap is there. So Motivation India is working with various partner organizations by having the range of products, but again it is not sufficient. We are also like evolving with the various range of products. Also we can see many startups are also having the many different types of products, but still it is not sufficient. So that's where it comes. We can have, there is a huge gap of the human resource. We saw the yesterday's one presentation, almost 30 million people need a wheelchair mobility problem, but how many people are there to help them? How many professionals are there to help them? The human resource or the trained human resources availability, if you see in the market, it's a huge gap. So we work with the many different decision makers to the field workers to the implementers to have the knowledge and skills to do the referrals, to do the service provision, to do the repair and maintenance. The end service is the repair and maintenance, right? That is many places it is missing. Even we do the same thing, right? When doctor says after 5 days you have to come to the follow-up, we will not go. It's natural because we are ready. But whereas when it comes to the assistive technology, the huge stuff is missing where the repair and maintenance and follow-up is missing. That's where the longevity of the usage, the longevity of the device, all those things are missing. The investments, what is put on that, it is going into the way. So that's what there is a huge gap. So we work with the many different managers level or the professional level or technical level people to have the knowledge and skills with them to work in the community level as well as the decision maker level to help the people. Again, our training courses, you can see we have more than 10 courses. Again, these courses in collaboration with WHO we develop as well as with our own experiences of 30 years we have developed these courses, and this is ranging from the various levels. It is not only the clinical level to help the service provision, we have from the decision maker level to the grassroots level where that is what it is required for the people and the community. And again, as I said in the beginning, we cannot do everything on our own. We need to join hands with many people. That's where our partnership comes. We have many partnerships with the government and government organization as well as the non-government organizations. We use many tools to develop the systems, services, resources, and also to influence the strategies, internal strategy in the organizations towards getting the right wheelchair in the right way. So ultimately at the end, we are helping the people with disabilities, not only just providing the wheelchairs, not only providing the spare parts or the follow-up or the mentoring and all those things, we also ensure the partner organization are including these people into the mainstream, into the education, into the livelihood, into the sports and recreation. That is also one part of the huge part of the things. And then I'm happy to see many people are into the para sports nowadays from India. Even we have a range of sports products also, entry-level sports products also, people are getting benefit out of it. And at last, like social inclusion. So this is not just bringing the people into the community. Morning Justin was very nicely, was just nailed out like saying that I want to take care of my children. So including into them, like they have to come out of the house, they have to attend the family function, they have to go to temple. This all like we see as a simple, for us it is very easy. But for the people with disabilities, it's like, they want to do it. So that's where the right products and right assistive technology is helping. So we ensure working with these partner organizations, including these people into the mainstream through these means. And we advocate for all these other things, for appropriate design on wheelchairs and dedicated the services into the rehabilitation setups. Also, one of the key thing is service provision approach. We don't encourage the donation model. And we also encourage having the clinical and technical resources into the existing resources. And now after doing all those things, again, if you ask me, do we have the change? Still it is, still there is a gap. When we see this basic 30%, there are some benefits are getting, whereas children products, when you see children range supports, or for the supports for the children or child wheelchairs, there is still the huge gap is there. That's where we have a young engineers are there in this hall. Why can't you take up something like this? Why can't we can think of like having a range of child size wheelchair or child size solutions for their postural support, for their mobility, and making the parents and families ease for their during the daily activities. So that's where still, if you see, the donation only going on. And we had this question, and then we started doing one survey as well as the research into 2021. So we have interacted some of the wheelchair users, some of the wheelchair services, as well as some of the trained personnel across India. And we use the different methodologies of desk review, focus group discussion, and interviewed many managers in the services, as well as random online survey through the wheelchair users as well as the rehabilitation professionals. We had some insights. The sample size, if you see, it's about 151 wheelchair users and 17 wheelchair services, 17 partner organization. It includes both government and non-government organization. And we have interviewed more than 137 trained professionals. It includes all the level, from the managers level, from the clinicians level, from the technicians level. Even we have interviewed wheelchair users also as a trained professionals. We trained even wheelchair users also as a professionals to provide the wheelchair services. And this is across 9 different states and 1 in union territory in India. So that's what the whole sample size. And the key findings was we could really feel and we could really get the information from these samples, saying that the longevity of motivation wheelchairs as well as the meeting the desperate needs and the effectiveness of the training programs, how it was, and the sustainability of the wheelchair services. That's how we can change the donation model into the service provision model. So in these 3 aspects, we had a key findings. So if I have to take you through all in this, the use of motivation wheelchairs, like almost like 60% of the people had an excellent feedback. They are really using it. It is really meeting their need in all the levels, in the immediate community, in the long community, wherever it is helping them. As well as if you see the other 2 categories, like a good and satisfactory, they are okay with it, but their needs are little diverse. So they are not that satisfied. It is helping them. Whereas the trained professionals, if you see, in this 17 organizations, there are almost, we can say, around 80 to 90% of the people there in the organization to serve the people. Whereas the difficulty level after the training to help the people to do the service provision, if you see, almost like we can say around 8 to 9 organizations, they don't have any difficulties, whereas remaining people were finding so much difficulty because of the resource and because of the funding situations. And the sustainability, if you see, we worked with more than 20 partner organizations in last 2017 to 2020. But during that tenure, almost we can say 50%, nearly 50%, around 8 to 9 wheelchair service organizations can able to sustain their service provision for the people. Whereas remaining people, they couldn't self-sustain because they were able to find out many different donations, many different cost sharing, many different corporate fundings, as well as they used different models of including the wheelchair users also as owners to pay for their wheelchairs. Not always kind receiving from somebody. So they also can donate, they also pay from their pocket and then own their device. So that's how they could able to self-sustain, whereas other 50% of the people couldn't do it because of the funding situation as well as the internal policies. And we could see real challenges from this study and from these stakeholders. The main thing is funding, and it is directly linked with the systems and policies within the organizations. It can be a government or non-government organization. So there is no choice-based system. There is no fund allocation beyond what is users need, and that led to have big challenge for the people to have the right products. Also, the trained professionals also sometimes they leave the organizations, they are not staying within the organization. That led to the sustainability part, who will take up the services once they leave the organization? It's a big question mark again. So that way, there was a big challenge many organizations faced. And within that, if you see the awareness among these people, when the organizations go for a fundraising with the donors, with the corporate social CSRs, or philanthropists, or even the public healthcare providers, or government healthcare providers, awareness among them is not so good. When we say the wheelchair, what is there in the wheelchair? But it is so much for people, right? So that's where the huge awareness gap is there across the country, we can say. And accepting the cost for an appropriate wheelchair. The basic wheelchair cost in India, we can say around 8,000 to 10,000 rupees, but that is not meeting the user's need. That is not within that price, whatever the products they are getting, that is not sustaining for a long time. Again, for down to 3 to 4 years, they have to again invest on other products. So people are not ready to accept a good quality product will have little higher end price. It's not so higher end, at least minimal amount which is required for an appropriate product, that people are not ready to accept, especially with this kind of group of peoples. Again, the wide range of availability of orthopedic products, orthopedic wheelchairs, that is also again coming into the market, hiding the need for the people with disability. So these are the biggest challenge. It is all interlinked when the people were telling, when the organizations were sharing their challenges. And the biggest learning what we were thinking is, still though the challenges were there, many organizations still they were following the user-centric approach to provide the service provision. They are getting the benefit. They are having a many case stories saying that yes, this is what it is required, and people also saying that I want this way. I don't want this wheelchair. Now the wheelchair user started saying I don't want this wheelchair. Though you don't have fund or not, I don't want. If you want, I can pay from my pocket also. I can raise funds for me. That way they started rising by themselves. Again, one innovative ideas by the organizations were cost sharing by the different stakeholders. Two, three funders coming together and helping the people. So if one person is not able to fund for it. And early identification referral system also very much important in these kind of settings. So that's how they can reach the many people in the remote areas. Also, some of the in-house training by the trained professionals within the organization also help the people. And follow up, as I said before only, the training this grassroots level organizations or grassroots level community based organizations, it really helped during the service provisions. And the recommendations, we strongly recommend, we need to have like mass awareness and sensitization among government and non-government agencies, also along with other stakeholders. Also, these stakeholders should think of having a choice-based system for the people. What they have, they should not give the choice. The choice should be from the user's hand. That's what we need to emphasize. Also, we know many times the product cost is higher because it is imported from the outside country. And why can't we have a local production? So we collaborated with Alimco, but that is not still sufficient. We need to have more local production in the country to serve a huge need. And we need to invest fund for the AT. And even Mr. Chappell was mentioning in the initial time insurance, why the wheelchairs or assistive devices are not covering. And there is one more interesting thing, to purchase a phone or to purchase a TV or purchase anything, we have loans. Why can't we have loans for assistive technology or assistive devices, so that people who wanted a high-end products, they can get it. They can just slowly pay for it. So these are all the different ways we can think out of the box, not always funding, not always just giving somebody to the people. And the next thing is, this is for the young people or the new engineers who can think of something R&D on the complex, intermediate to complex postural type of wheelchairs, so that they can get benefit. The children or the postural support devices who need, they can get benefit. Also, it is not only the few professionals whoever is got trained, it is not sufficient. Even the upcoming trained professionals or upcoming professionals also should get benefit, right? So that way the curriculum should be integrated into the various curriculums of the engineering, in terms of social work, in terms of physiotherapy, occupational, various curriculums. People should have these kind of AT things into them, So saying that it should not be just given away, they should contact the appropriate service personnel to get the right products. And laws, can we have a national AT standards, provision standards? Can we have, so that it allows all the stakeholders to follow the system, so that then only the changes can be made and then only we can see. Otherwise, everybody, we can sit in a smaller pockets and then do many things, but still we are not able to meet a huge need, right? So can we have something on this? Maybe we have a big stakeholders here. You all can think of, we all can come together to have a big AT standards in India, so that we can have a good products and we can help the people with disabilities at the end. So that's it. Thank you so much for listening. And this is my details. You can reach me anytime. Thank you.